imagine developing kidney failure in your 30s, even though you don't have any diabetes or high blood pressure or any other medical problems. This is happening to thousands of agricultural workers around the world. And over the past 2 decades, more than 20,000 deaths in Central America have been linked to this mysterious kidney disease. In countries like El Salvador, chronic kidney disease has become one of the leading causes of death among men that are aged 30 to 59. Researchers call this condition chronic disease of unknown etiology. And unlike most kidney disease, it affects young and otherwise healthy workers with no past medical history who spend long hours physically demanding labor in extremely hot environments. So today I'll explain what the disease is, where it happens, how environmental factors and climate change might contribute to it, and other solutions for this problem. So to understand why this disease occurs, it's important to first understand what is a kidney and what they do. The kidneys are two organs located in the lower back that filter waste and excess fluid from the blood. And although they make up less than 1% of the total body weight, they receive about 20 to 25% of the heart's entire blood flow, also known as the cardiac output. Inside the kidneys are millions of small units called nephrons, which remove toxins, regulate electrolytes, and maintain the body's fluid balance to make sure it's all in equilibrium. Because the kidneys rely on constant blood flow and proper hydration, they're particularly very sensitive to changes in fluid status. When the body becomes severely dehydrated or exposed to prolonged heat stress, kidney blood flow can decrease, and that can quickly lead to injury. So, chronic kidney disease of unknown etiology, also called Mesoamerican nephropathy, is a form of kidney failure that occurs without the traditional risk factors that we usually think about, such as diabetes or hypertension or heart disease. Most chronic kidney disease worldwide, again, is caused by that diabetes or hypertension, but these patients do not have either condition and usually have no other conditions at all. But instead, this disease affects mostly young male agricultural workers, especially those harvesting crops such as sugarcane, rice, and cotton. And studies have suggested that 80 to 90% of these affected patients are male workers between those same ages of 20 to 50. In some agricultural communities, researchers have found that up to 15 to 20% of workers show signs of kidney damage despite having no traditional factors as well. The hypothesis is that repeated cycles of extreme heat exposure, dehydration, and kidney injury over many years gradually lead to the permanent kidney damage. So now where is it happening? So this disease has been reported in several regions of the world, but it's most well documented in Central America and South Asia. Countries such as El Salvador, Nicaragua, India, and Sri Lanka have reported large number of cases among agricultural workers as well who spend long hours performing very heavy labor in hot climates with limited water supply. In some regions of Central America, kidney disease mortality rates are up to 5 times higher than the global average compared to those that do have risk factors such as diabetes, hypertension, and heart disease. And overall, researchers estimate that millions of Americans worldwide may be affected by CKD of unknown etiology, particularly in communities where agricultural work is performed under extreme heat conditions. And the health impact of this disease can be very severe as well. Workers harvesting in these crops can be exposed to extreme heat that can lose 2 to 3 liters of fluid during a single work shift due to sweating, which can then lead to significant dehydration. And this repeated dehydration causes that acute kidney injury, and over time, this repeated damage can cause chronic kidney disease and eventually kidney failure requiring dialysis, which can be done up to 3 times per week, and especially in low resource regions, access to dialysis may be limited as well, and mortality can be much higher. So some solutions. Fortunately, there have been several interventions that have been developed to protect the workers from that heat-related kidney injury. The most common approach is the water, rest, and shade intervention, which encourages employers to provide regular hydration, scheduled rest breaks, shaded areas, and easy access to all of these things during periods of extreme heat, especially while on the job, and very easily accessible. Research has shown that these workplace interventions can reduce markers of kidney injury among workers by nearly 50%. So therefore, improving workplace protections, providing access to clean drinking water, and implementing heat safety programs can play an important role in preventing this chronic kidney disease of this actually known etiology of extreme heat exhaustion.